Hi, everyone. I'm Jonathan Whitham, Executive Director of the Indiana Department of Homeland Security. As we celebrate EMS Week, I'm thrilled to welcome our State EMS Medical Director, Dr. Eric Yazel. Dr. Yazel has served as an emergency department physician, a local health officer, and worked for community health centers, making him a strong advocate for healthcare in Indiana. Dr. Yazel, thanks for being here. We're looking forward to talking about where EMS is headed, how the state is supporting providers on the front lines, and what the future of healthcare looks like here in Indiana. To start off, what is EMS Week and why is it important here in Indiana?
Well, it's somewhat self-explanatory. We honor our EMS professionals that are out there. And EMS is a challenging field. I don't think there's another profession that combines the public expectations with the knowledge base required, the stress and toll on your mind and body. So I think it's really important that we recognize them and make them feel appreciated and also kind of showcase what they do out there every day for our communities.
And for listeners who may not be familiar, can you talk a little bit about the role of EMS here at IDHS?
Absolutely. We do a lot of different things. I think I'll start with our district managers. They're kind of the eyes and ears of the organization, our boots on the ground out in the state, watching what's going on, helping with issues that may arise. We have our mobile integrated health team that goes out and supports our programs, allowing to fill some gaps in the community healthcare continuum. We have data professionals, mobile sim labs, and then licensing and certification staff that help keep our folks up and running, and then our managerial staff that kind of oversees all of that. So just a lot of different roles. One thing that I think is really exciting is I think historically we've been more of like a regulatory agency, but now we're kind of a regulatory and support agency, and we're doing a lot to help our services around the state. So.
Very good. And can we talk a little bit about the personnel around the state? So the number of people that are credentialed in EMS, so EMTs, paramedics, what does that look like in Indiana?
Yeah, we crossed the 25,000 barrier in 2024 and continue to grow. We have about 14,000 EMTs, over 5,000 paramedics, and we have around 800 advanced EMTs, and then 4,600 emergency responders as well. And it's still growing, not as fast as our run volume is, so it's still a challenging time out there. But we are seeing our numbers gradually rise every year, which is a good thing.
Yeah. Over the last, say, 10 years, what do you think has been the biggest change in EMS around our state?
Well, I think I touched on a little bit that we've seen our run volume go up almost 500,000 runs a year, with a more modest increase in our workforce. So they're spread thin. And then also some of the changes in our healthcare environment. Instead of being just the more traditional model where someone calls 911, an ambulance comes and takes them to the hospital, we've looked at some other things, our mobile integrated health programs, other ways to integrate ourselves in the community, and creative ways to make the best use of our workforce, in order to respond to that strain.
Yeah. For community education, which is a really important topic, what can EMS provider agencies do to help with the way that we interact with the community and educate them on EMS issues?
I think it's hugely important. We're a trusted source. There's so much information out there of various quality, and I think there's a public awareness that we're out there doing it day in, day out, and we're kind of a trusted entity. So I think when we provide education, we have the public's ear, and I think it's important to embrace that role and to really get out there and impact the safety of our community with that education.
Mm-hmm. Pediatric care is very specialized. So what are providers doing and what are we doing to help those providers understand how different pediatric care is in EMS and make them more comfortable when it comes to dealing with children and injuries and illnesses that they may be dealing with?
It's extremely important. I mean, there's nothing more challenging sometimes than a high acuity pediatric illness. And it's one of those things we call halo procedures, high acuity, low occurrence. Because we fortunately don't have a lot of critically injured children that we're running on day in, day out. So figuring out ways to prepare our EMS professionals for a condition they may see, once a year, once every couple of years. So that's where I think, very intentional education, high fidelity sim training and things like that. And then very simply, I always tell our services, take the first day of every month and run through some of those high acuity situations that you may not encounter And when the time comes, you'll have that muscle memory
Yeah.
to be able to respond appropriately.
Yeah, practice makes perfect. Right?
Absolutely.
Yeah. What's the biggest challenge facing EMS right now in Indiana?
I think just the kind of the changing healthcare environment right now. We're seeing a lot of barriers to access to care. So EMS and our emergency departments tend to be the safety net for that. And so we may encounter conditions that we haven't encountered in the past. As we're seeing some changes in our specialty service delivery across the state, we may be transporting patients farther to certain centers and things like that. So what may have previously been a 5-minute transport may be a 50-minute transport. And so recognizing those changes and training appropriately for that, I think is really important. And I think just recognizing and having some visibility on the need for wellness and support of our providers, mental health, just overall health. You're sitting in an ambulance for a significant amount of time. It's hard to exercise, eat right, things like that. And so I think just recognizing that and supporting our workforce is huge.
Yeah, I agree. We've seen a lot of new funding mechanisms and grants that are coming in for a lot of those rural health initiatives the last few months and years. Can you talk a little bit about some of those initiatives and how they're going to have a positive impact on rural Indiana?
It's an exciting time. I always say I don't know that I'll ever in my career have the resources that we're seeing right now with some of the Rural Health Transformation Act. And in Indiana, that's called GROW is what it's called. And there's several different initiatives that are meant to support the rural healthcare system delivery that are EMS related. And a lot of them touch EMS in some way. There's a regional medical operations center model that will help us with interfacility transfers and destination decisions and some of those things that are really challenging for our providers. We'd already talked about pediatric readiness. There's some equipment and SIM support for that, as well as for maternal health. That's been a big area of focus in Indiana as well. There's some support for our mobile integrated health providers, telemedicine, where we can help some of our citizens in rural areas stay in those areas and still receive quality care. And just a whole litany of other things. The regional model, where our different regions of the state have some autonomy to decide what's best for them. And there's some really neat EMS related initiatives that are developing out of those meetings as well.
You mentioned mobile integrated healthcare and mobile integrated health teams that are popping up around the state. Can you talk a little bit about how those benefit the communities where they're popping up?
I always say if mobile integrated health, everybody wins. First of all, just by being identified as a potential mobile integrated health patient, there's some sort of healthcare vulnerability that leads them to be in that situation. So you're taking care of your community's patients that need it the most. From the EMS side of things, you're taking providers traditionally outside of the 911 system and delivering that care, freeing up the ones who are on the 911 side to take care of our sickest. Also, a lot of the programs reduce hospital crowding and other things, readmissions. Our beds are a precious resource. And so if we're able to make sure we're utilizing those, that's a huge benefit to our hospitals as well. So basically every aspect of the healthcare system gets benefit from MIH. And there are very few things in healthcare where you don't have to trade anything off. It's a benefit for all. So
some amazing programs in Indiana and some of the pioneers really that have popped up the last several years. Crawfordsville Fire Department, I know, is looked at as kind of the gold standard for mobile integrated health, even across the United States. So
it's always amazing when we go to the conferences and hear, and see what's going on out there and recognize that we are blessed to have some of those trailblazers in that field. And also one of the things I think so exciting is they're so willing to help other programs. It's almost like a rite of passage. If you're starting a program, you say, you got to reach out to this program, and this program, and they can't respond fast enough to help you raise the bar. So it's an exciting time, and just to watch that collaboration is really neat from our standpoint.
There's a big push right now for citizens to be trained in some of these life-saving skills like CPR, using an AED, stop the bleed. How can EMS help educate the public and help push some of these trainings out so that we have more citizens ready to jump in with these skills if and when they're needed?
I'm a huge advocate for enabling a layperson response. All the amazing things we're doing in healthcare, the two main fundamentals still stand true: early CPR and early defibrillation. And so a lot of times, even when our EMS systems get there, the die's already cast one way or another, and so reaching out to our communities, holding CPR training, working with our businesses, churches, schools for AED registries, training Stop the Bleed so you can handle any kind of traumatic injuries, Narcan programs, all these things. We have a lot of rural areas in Indiana, but we have citizens everywhere that are willing to help their neighbors. I live in a rural area. I've got an ER charge nurse down the street. I've got a firefighter the other direction. And, we have an AED that we can all get to within 5 minutes. And so, we're all willing to help our neighbors. So helping give our citizens those tools and just have that continuum of care between a layperson to EMS to our hospitals, it's going to benefit every Hoosier.
Absolutely. Mental health is important for all humans, but first responders seem to need it and historically have been a little bit more resistant to search for those resources. Can you talk a little bit about the resources that are available for EMS professionals who may need to talk to someone or seek some sort of support?
It's a challenging environment. In some other business sectors, they teach you how to avoid the stressors and things like that. We know it's inevitable. All our EMS professionals are going to see things that no one was meant to see. And so figuring out how to support them through that. And some of them are very intuitive, just a, horrible traumatic event and things, but some of them are more minor and just the day in, day out toll. So a lot of our services have great resources in place. Some of them are a little more challenged. And so determining how to reach out to our service and support the ones that are doing it well and help grow and share those resources, and also go into some of our areas that have more challenges and help them bolster what they have available. And it's different for everybody. Some of it's in person. Peer support is a big thing that we've been fostering. A lot of virtual options now, as we're kind of a 24/7 sort of specialty. So the old appointment card on the fridge isn't always the best option. So just kind of giving everybody a smorgasbord of options that they can determine fits their needs the best is kind of our goal. And when we're still putting programs into place every single day to help.
Good. It's very important. Credentialing is also important. So when we are licensing paramedics and we're certifying EMTs, we want to make sure that process is seamless and that we're getting the best quality candidates into the system. What does the future of credentialing look like for Indiana? How are we going to continue to encourage people to become EMTs and paramedics and build those numbers up even beyond where they are right now?
Well, one of the things is our credentialing staff's done a great job. When I used to travel the state, that was always one of the first things I heard is there's been delays and this and that. And I have not heard that. I think they're doing a wonderful job and they've worked really hard. And I think what we've done is leverage some of the technology. We've started to make things more automated. The old days of handing over your book to be signed and things like that are kind of going by the wayside. And also with some of the national programs, figuring out how to mirror those so that there's no redundancy in your work. Is really important too. It's a fine balance. Obviously we have a duty to protect our citizens, to make sure that people are going through the appropriate licensing and credentials process, but we also don't want to make it overly burdensome. And with our workforce issues, we don't want to lose any of our potential providers just for clerical issues or, saying, hey, this is too much of a hassle, I'm going to let my numbers expire. So I think continuing to adopt the new technology is only going to make it easier and easier. I use state in-service as an example. We have a QR code that just automatically loads it up into your continuing medical education modules and makes it very easy. And I think those processes are things we're going to just continue to develop in the future.
Great. And you mentioned technology. So how is Indiana using data and technology to improve patient outcomes and enhance the entire EMS system?
It's really improved astronomically over the last few years. Being able to, when I'm big in getting out into the state and doing site visits, and I like to sit down with an agency and say, here's your number of pediatric runs, here's the procedures you did, here's how many intubations you've done, here's your success rates. And so instead of just saying, we're going to educate, locally on EMS in general, they can do targeted education. Our IV success rate wasn't as good last month. Hey, let's do an in-service on IV. So having that data available in real time so our services can respond, I think that's a great role the state can play, because most of our services don't have the resources to be able to do that in-house. So having that and being able to go out and help them with targeted education is a huge thing for us.
Very good. And for young people who are out there right now, or even people who are already into their careers who are interested in EMS, and interested in becoming an EMT or a paramedic or helping with this system, what message would you share with them today?
I would say it's the highest calling. You are going to an undifferentiated situation. You're a lot of times the very first person on the scene in the worst day of somebody's life. They have called EMS for something that obviously is stressful to them, whether it be an illness or other situation, and you're the first one on the scene and you're the first one that has a chance to make an impact. And there's no higher calling than that. And again, we're the safety net for all the things that are going on out in the healthcare system. So, it's a huge responsibility, but also very rewarding. And we're continuing to try to give all our EMS professionals the resources to do that very successfully. And it's an exciting time for EMS.
Well, Dr. Yazel, thanks so much for joining us and for recognizing EMS Week. We appreciate your leadership and your commitment to strengthening EMS across Indiana. And to all the EMS professionals listening, thank you for everything you do for Hoosiers. We're grateful for your service, not just this week, but every day. To learn more about EMS Week, visit emsweek.in.gov.